Well, Jeannie, the most important thing is the concern is that the preliminary evidence suggests that there might be an increase in reinfection with Omicron from people who've already had a previous infection with COVID-19, with the earlier variants. So that is the primary concern. But as you mentioned, the science is still out. Also, yesterday, the World Health Organization sent a technical note to its member states where it said the Omicron is a highly divergent variant with a high number of mutations. And the concern is whether it's associated with an immune escape potential. In other words, the defenses that we have right now might not be sufficient. But the science is out. They've got to do the epidemiology and the hard hours in the laboratory to find out whether the vaccines are still effective and whether the therapeutics are also still effective. So there's a bit of time down the road before the science lines up and tells us exactly where we stand with this.
Absolutely. But given the fact that we still don't know exactly where we stand, and there are countries like Japan and Israel already closing their borders before they get that science in, does that mean that they're just jumping the gun?
Well, the international health regulations basically stipulate that member countries should base measures on scientific evidence. But of course, member states are sovereign, and quite a few have taken the decision. And this was criticized yesterday by the regional director of the World Health Organization for Africa, Dr. Moeti. And she said travel restrictions may play a role in slightly reducing the spread of COVID, but place a heavy burden on lives and livelihoods. And the countries right now that are being penalized are some of the poorest in the world.
John, thank you for that. John Zarocostas there reporting from Geneva. Meanwhile, the UN's